My name is Gary Mendell. I'm the founder and CEO of Shatterproof, and I'm truly honored to be participating in the 5th International Vatican Conference. As we all know, the past 15 months have been so difficult for so many. However, it's heartening to know that science is answering the call and leading the way for safer days ahead for all of us. I'd like to now share a story of 2 boys who were growing up in Easton, Connecticut, a small New England town where I raised my family. The year is 2004, and both boys were in high school. The first, Mikey, was diagnosed with cancer. As you'd expect, his family was devastated. However, they were easily able to access the highest quality medical care, all based on science. Mikey's family told their friends, and our entire community rallied behind Mikey and his family. Parents came to their home with cooked meals, drove carpools. The kids in our elementary school held bake sales on the weekends to raise money for Mikey's new charity on cancer research. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease could ever dream of. 2 streets away, my son Brian was also struggling with a disease. But for Brian and our family, it was different. We looked for medical care for our son, but we couldn't find any that was based on science. I didn't tell too many of our friends what Brian was struggling with. To be honest, I was embarrassed, and I felt like a failure as a father. And our community didn't rally behind us. No cooked meals, no carpools. But even worse, unlike Mikey, when he came home to visit from treatment, he came home to a welcoming community and bake sales. When Brian came home, it was just deafening silence. The disease my son struggled with was addiction. In over 8 years, Brian went to 8 treatment programs. Each one was different, except for one common element. Not one of them treated my son with protocols based on science. At one treatment program, I asked, "Are you also treating him for his anxiety?" And they said, "No, we don't treat for anxiety. Your son needs to just try harder and stop using drugs." At another treatment program, Brian relapsed. Instead of recommending a more appropriate or higher level of care, he was just kicked out and put on the street. At his 7th treatment program, he was finally prescribed a medication, which has proven to significantly improve the outcomes of those who are addicted to opioids, which Brian was. It was unbelievable how well it worked. It just connected well with Brian. He was so happy, he was enthusiastic, he was confident. The old Brian was back. But then when he was released from that treatment program, the residential, they recommended an outpatient program. In his first day there, they said, "We don't believe in medications. You have to get off it." And I look back on those years, they were so difficult. However, Brian just continued to try his hardest. I can't tell you how many times he looked at me with that big smile of his and said, "Dad, I'm getting this. I'm going to beat it. Please don't worry, Dad." But addiction always doesn't work that way. On October 20th, 2011, I was woken up in the middle of the night by my cell phone ringing, and I was told that my son had just died. He was 25 years old. And equally tragic, he hadn't used a substance in 13 months. It wasn't addiction that took his life. It was the feeling of shame he had every morning when he opened his eyes, of all day long feeling like an outcast, that caused him to wake up that morning, research suicide notes, write a note of his own, light a candle, and take his own life, alone. And ever since that day, I've continually asked myself the same question. If both boys had a disease, why are these stories so vastly different? Science tells us that addiction is a disease just like any other. However, so many in our society disagree. They say those with this disease have a character flaw, and they and their families are isolated, judged, stigmatized, and silenced. A few days after Brian passed away, my wife framed a serenity prayer and placed it on my nightstand. I think in those early days, reading that first sentence in that prayer was the only thing that kept me alive. God, grant me the serenity to accept what I cannot change. However, as the weeks and months went on, I began reading and thinking about that second sentence. The courage to change the things that we can. And with Brian in my heart, I began to research what could be done to help others, to spare others. As I did so, I was destroyed all over again. When I learned that the United States federal government had provided grants of tens of billions of dollars to researchers, and those researchers had successfully used that funding and created this wonderful body of knowledge that had proven without any doubt to be able to significantly reduce the number of our loved ones who ever become addicted. And also for those who had developed a disease, to significantly improve outcomes for those in treatment. Yet all this information was sitting in peer-reviewed medical journals. And I learned that hardly any of it had been implemented or was being implemented. As a father, it destroyed me. However, I realized that sitting right in front of me was the answer to my original question of how to spare other families the tragedy my family had suffered. It was simply implementing the research that existed. Putting this all together, I soon left my business and dedicated the rest of my life to this cause. And from this, our organization, Shatterproof, was born. Born with a vision that our society would prevent and treat this disease with programs based on science, without any shame or stigma or judgment, just like any other disease. As I speak with you here today, I miss my son desperately, every day. However, in many respects, I feel blessed. I've had the opportunity to meet so many wonderful people all throughout the United States and some internationally. Hundreds of thousands have now joined our cause. And together, we have made significant impact on making our vision a reality through all the program we've done with prevention and leading a transformation of the treatment system. However, we can do more. We must do more. And that's why I'm here today, to ask for your help in overcoming the most important and difficult obstacle that we must overcome. It's the way that we think about this disease, the way we speak about it, the stigma we attach to it. Because of the stigma, 20% of Americans who are addicted today have reported that they will not seek treatment because they don't want anybody to know. 1/4 of primary care doctors will not treat those addicted to opioids because they're afraid of what it might, the perception of how, the perception on their practice. It may be a negative perception. More than half of emergency and primary care doctors believe that addiction is not treatable, when it is, with the same success rates as many other chronic illnesses like heart disease, diabetes, etc. I can go on and on about the barriers that stigma creates for those with this disease. But I can tell you, however, I can tell you one thing for certain. If we as a society can shift the way we think about this disease, more people will seek treatment. More people will feel loved and connected. Fewer will die. And fewer families will be shattered beyond any repair, as has mine. And knowing this, our organization spent 15 months studying 11 social movements that have been successful around the world in changing the way society views a particular health issue. And from this, we developed a plan. A plan that will, once implemented, will significantly reduce the stigma of addiction and ultimately end it. And we are now in the beginning stages of implementing it. In closing, I often think about my son's last visit home. It turned out to be 4 months before he died. And that last night, we're sitting on the back porch. He looked at me and he said, "Dad, I wish that someday people would realize I'm not a bad person. I'm a good person with a tough disease. Dad, I'm trying my absolute hardest." Well, those days have been way too far off into the future. We haven't accomplished it yet, but now it's time. Please join with us. Let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you.